So it's possible that you've already heard a lot about ChatGPT and large language models in general. Maybe you've played around with it, or maybe you've started using it in clinical practice. In this video, I'm just going to navigate through getting started with ChatGPT and then give a couple of examples of how it might be useful or not useful for clinical practice. So if you've never used it before, you can sign up. Otherwise, you can log in. You can log in with an email, Google, Microsoft, or Apple. This is the ChatGPT landing page. So really important to note is that I'm using GPT 3.5, which is the free model, but it has not been updated since September of 2021, so it will not have the most up-to-date information. You can also upgrade to GPT-4 for $20 a month, and that will be more updated and faster. So let's get started by asking it a question with a polite introduction. Hi, ChatGPT. I'm going to ask you some medical questions. I'm a medical professional. Is that okay? And it responds, of course, doctor. Feel free to ask medical questions, and I'll do my best to provide concise and accurate answers. So first, let's start pretty general. I'm going to ask it, what are some types of dangerous rashes that I should look out for as an ER doctor? So it's going to create its response, and it's provided us with a list of 5 rashes that I think would satisfy any attending who's trying to pimp you or maybe jog your memory when you're trying to go into a patient room before seeing a person who's sick and has a rash. But let's get a little bit more specific here. I'm going to ask it a case and see what it can come up with. So can you help me with this case? A 34-year-old woman presents to the ER with joint pain, headache, and a rash. Her vital signs are a heart rate of 110, blood pressure 128/92, temp 101.2 Fahrenheit. She's otherwise healthy. On exam, you notice red eyes, dry mucous membranes, and a diffuse maculopapular rash. What do you think is going on? So ChatGPT thinks that it's Kawasaki disease based on the information that it provided, but it thinks that it's also important to consider other possibilities such as allergic reaction or viral illness, and recommends further diagnostic testing. So let's give it a little bit more information and see how that changes what it says. She reports that she recently returned from Angola. How does this change her differential? So now it says that because the patient recently traveled to Angola, one possible consideration is loss of fever, which could cause these symptoms. However, other tropical diseases like malaria, dengue, or chikungunya should also be considered in the differential diagnosis. In this case, a thorough travel history, specific diagnostic tests, and consultation with an ID specialist may be necessary to confirm the diagnosis and guide treatment. Let's see what testing it would suggest. So it's giving us a list of tests. Some of them I would or wouldn't order from the emergency department, such as I'm not going to order a skin biopsy, but certainly would consult ID and start running some of these tests. ChatGPT is not the only large language model that's currently available, so you should play around with the other ones and even submit the same question to multiple models to see what answers that they give you. Some of the alternatives include Bard, which is Google's large language model, Claude, which is created by Anthropic, and then Bing's new search engine, which is also powered by AI.